And I'm here today on behalf of my team to talk about two specific public health services that have exhibited potential to achieve outcomes beyond what was expected, and those are the sustainability parts of it. It's not working. The keyboard is not working. Move on to the next slide. Oh, sorry. Yeah, okay, fine. So in New Zealand, problem gambling is formally recognized as a public health issue in the New Zealand Gambling Act. And the Act requires an integrated strategy that's not just only providing treatment to problem gamblers, but also to do public health work focused on harm minimization and prevention, in addition to research and evaluation. So on the public health side of things, how the ministry achieves this is through funding of 5 distinct public health services, and I'm here to talk about the third and fourth one. So each of these public health services comes with a service description that talks about what the objectives are and what the expected outcomes are. So for supportive communities, the objective is to build community resilience and to enhance social protective factors. Aware communities is as self-explanatory in the formal name given to this service, is to build community understanding of the broad range of gambling harms that's out there. And the reason that we've combined these two together is because although with distinct objectives, they had similar recommended activities. For example, media engagement, promoting public discussion, and things like that. And both these services were highly community focused, and this, we believe, is the feature that makes it quite different to conventional approaches like education or paid media campaigns. Just a brief overview of the methods, evaluation methods that we use. It's guided by a logic model framework where we looked at the entire spectrum from inputs to activities to outputs and what the outcomes were. We also looked at external influences that can have an impact on at any stage of the process, and also any unexpected outcomes. Evaluation criteria was based on the service specifications of these two services, and also a set of evaluation standards that was agreed on with the ministry. For the data sources, we relied on 3. The first one there, the 6 monthly provider progress reports, was the key one, and that was over a period of 3 years, submitted by about 18 service providers throughout New Zealand. And then we also did a staff survey and a focus group interview with public health staff, and supplemented with a literature review. And the interesting thing with the literature review is that we found hardly any comparable services that has been implemented at a national level elsewhere, which suggests that these two services are likely to be quite novel and possibly first of their kind. As I mentioned earlier, the two services achieved expected outcomes, that is enhancing public awareness and building social protective factors, but we're more interested today in these 2 key concepts. Program sustainability is when a program achieves a life of its own and is able to carry on achieving outputs and outcomes independent of the service initiator or the funder. Social sustainability is different. It's part of the broader concept of sustainable development. Put simply, social sustainability is when within a society, all individuals are able to fulfill all of their human needs, not just basic needs, but other needs like your emotional needs and your self-actualization needs. And they live in a society that enables this. In other words, they're able to live up to their fullest potentials. So social sustainability is a difficult concept to understand. It's probably easier to, when we look at the factors that both contribute to and describe what social sustainability is. For example, the first one, social equality. In societies where there is extreme social inequality, you will tend to see higher levels of social problems like crime, not to mention riots and war. So in other words, it's the things that glue a society together to make people feel safe, like they belong. Okay. So in the next few slides, we will present all the different outcomes that the providers reported on, but we will just talk about those specific outcomes that has the sustainability potential that I mentioned earlier. So one of the key processes is stakeholder engagement for these two services. So when delivering services, it's not just about the provider going out there and delivering programs, but it was about working with other services and sometimes participating in events that other public health services organize. So in that process, relationships were developed and plans were made to continue doing it on a yearly basis. And that's an indirect indicator of program sustainability. So service providers also focused on at-risk communities. And again, it was different in that it was not just going out there and talking to people and doing presentations, but working collaboratively with community groups, getting them into the program. So if you look at that second example there, one provider worked with community elders and drew the knowledge that they had about their community and then built that into an awareness program in a way that the elders could deliver the program for their own community. So this is a key thing because it's literally transfer of knowledge from one generation to another, and that's a key aspect of social sustainability. Another approach also was like jointly organizing events, and in the process, some providers found that the community group started taking ownership of the program, so it became their program, not so much the service provider's program anymore. So it's their program, and that is program sustainability potential. So the chances are, because the community is feeling so empowered, so passionate about this program that they see the value of it, they're quite likely to continue doing it, independent of the service initiator. Just to give another example, sometimes these programs were delivered, if we take the driver license program, on the surface, it appears to have nothing to do with problem gambling. But this program, because it incorporated bits of gambling-related education, it not only enhanced participants' awareness of participants' awareness of gambling harm, but it also led to other outcomes like enhanced self-confidence, self-esteem, and job prospects. So these are individual protective factors. But when you look at it from a broader scale, it also contributes to social sustainability because you are equipping these individuals with what is necessary to fulfill a very basic human need, and that is to be employed. Some approaches were focused on youth, and again, it was not just presenting an education program, but it was incorporated in other programs that is interesting to youth, that is relevant to youth. In one case, it was an after-school kapahaka dance performance that also incorporated gambling harm messages. So these programs not only developed youth understanding of gambling harms, but it also enabled youth to reconnect with their cultural identity. So it's, in other words, about building cultural capacity, and again, a key social sustainability enabler. Providers also engaged with the media, especially with the Aware Communities public health service. But the approach was different. It's different to paid media campaigns where you pay and you secure some space and you have some advertising. But the approach was rather developing relationships with the media representatives and also involving the community in the media messages. So that meant reaching out to all the smaller ethnic media and delivering messages in languages that are appropriate to the communities that you're targeting at. So indirectly, that's a recognition of ethnic diversity in New Zealand. So imagine if you are from an ethnic minority group, and then you see a media message in your language talking about gambling harm, directed to you that you can immediately relate with. You would feel in New Zealand you're recognized, because here are gambling harm messages in a language that is made for you. And that is a key, a very important key to social sustainability. People feeling that they belong. Because community were involved a lot in the media messages, it gave community a voice. So it was not a top-down one-way flow of communication, but the public were also able to voice out and express. So it was a two-way flow of communication. And this was especially possible with talkback radio shows in New Zealand. So to summarize, so in addition to enhancing awareness, the two services had key strengths in terms of program sustainability, and it was because the approach was not just informing people, but working with people, both in program development and in implementation. And there was also efforts to purposefully develop people's capacity to continue with the program delivery. And in some cases, there were development of reusable resources, so it's things that can be reused again without additional funding input. And then plans for ongoing collaborative work. So all these are features that describe a program's strength in terms of sustainability. And then there were these less clearly identified outcomes, like community participation, feelings of empowerment, trustful relationships, recognition and acceptance of diversity. These are not easily measurable outcomes, but they are social sustainability enablers that has additional outcomes that has come out from delivering these services. Challenges. Cost is probably would be a key issue for such a program, for such a community-focused program, because it's a high involvement approach for a very small outreach. And there's also extensive time required in terms of staff time, both for relationship development and to fit with community's time availability. So delivering these services are not always a 9-to-5 job. The terms at-risk communities and problem gambling posed challenges when used within public health messages. And Professor Heng this morning highlighted the importance of considering that when it comes to education. And then the fourth challenge, difficult to measure outcomes. So we would like to summarize 4 key points to consider for implementing such services in future. If your target population is large, you want to aim at the whole country, for example, then media campaigns are probably more cost effective simply because of the cost per person reached. Whereas the approach that I talked about is more appropriate when it's smaller groups of community that you're targeting at. And staff time needs to be considered in the equation, both in terms of developing knowledge and for building relationships. Message effectiveness is an important thing. It may be necessary that you consult with the target communities themselves to ensure that the public health messages are going to be effective and also culturally sensitive. And also staff training on effective communication approaches. We could consider making program sustainability an aim, simply because this would lead to a more proactive efforts to involve community in your programs. And that can lead to a recognition of problem gambling as a commonly shared public health responsibility, as it is now with other public health issues like drugs and alcohol. Having program sustainability as an aim also reassures funders of the cost and effectiveness of their present investment, as well as future value for money decision making by focusing on programs that has this potential to continue having an impact. Social sustainability, if it's made an aim, it's of value because social sustainability in itself can act as a gambling harm prevention. In a society that's socially sustainable, you will have less social problems in general and less people engaging in gambling harms. And it can also function in a reinforcing loop. For example, if you've got more people involved in your programs, the more effective your programs are going to be. So sustainable development. In New Zealand, it's only implicit in public health efforts. And maybe because it's so difficult to measure and identify, social sustainability when compared to environmental sustainability and economic sustainability is the least talked about and least researched as well. So within a public health context, by identifying and measuring these social sustainability enablers, we believe it can lead to a greater understanding of the role of social sustainability in harm prevention, and also a recognition of the value of social sustainability within a nation's sustainable development aims and goals. So you can have a public health program that achieves outputs and outcomes in a fixed time frame or in a fixed, within a specific community. But if you include program sustainability and social sustainability, it enhances potential for ongoing harms prevention. And that we believe is really important when we consider how fast and how broad the gambling market is expanding. And with that, I conclude, and we thank the Ministry of Health for the funding for this research, the 18 providers whose reports informed the findings of this evaluation, the public health staff who participated in our survey and our focus group discussion, the conference organization for this opportunity to present, and the audience today for listening. Thank you.
Thank you very much, Komi. I must admit, I found that quite interesting, and it's reassuring as well that something that we do here, our public health providers and the treatment services are going out there and doing all this hard work, and that we can see it's beneficial and it's sustainable, and in terms of reducing gambling harm and continuing to reduce gambling harm. We do have time for a few questions if anybody has any questions for Komi.
Are we able to obtain a copy of the presentation at all?
At the moment, I have to say no, because it's going to be submitted for publication, and yeah. But the report is
available. It's available currently on the Ministry of Health's Problem Gambling page website.
Thank you.
And it will be available on our AUT website as well, but it's not there yet. But you can get hold of it. There's actually 3 reports, and there's one specifically on the public health side of things. So, so yes.
But however, the report won't talk so much about the sustainability outcomes, because this is a secondary look at the data. It won't be in the report, but it will be in the paper.